And welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, March the 31st. We are joined today by our CEO, Nicole Dupuy, our acting MOH, Dr. Shanka Nasathuri, as well as the manager of our epidemiology department, Ramsey D'Souza. We will start with opening remarks from Nicole and Dr. Nasathuri, followed by the epi summary from Ramsey, and then media questions. Nicole, if you want to get started.
Sure. Good morning, and thank you for joining us today. Earlier this week, we celebrated the success of the Devonshire Mall mass vaccination clinic. The organizations and the people that came together to make it happen, and the approximately 220,000 doses of COVID-19 vaccine that were administered there. Locally, 8 mass vaccination sites have been established throughout the pandemic, thanks to strong community partnerships and collaboration. We would not have achieved this if not together. I want to once again thank every person that supported this effort and every person that walked through the doors of one of our sites to get their vaccine. With our community's combined efforts, we can proudly report that we have administered nearly 900,000 doses of COVID-19 vaccine in our community. As we transition out of the Devonshire location, it's important for everyone to note that our vaccine efforts are not over. We urge everyone to stay up to date with their vaccination. If you are eligible, vaccinate. Pharmacies, primary care offices, and mobile clinics will continue to offer opportunities for first, second, third doses and fourth doses of COVID-19 vaccine. Today, I would like to take a moment to personally thank the staff at the WeChew. It is the staff that are the heroes and the history makers. It's through their hard work and perseverance that we were able to tackle this incredible challenge. I cannot express how proud I am to be part of this extraordinary public health workforce. From those on the front lines at the clinic to those supporting the behind the scenes work, we honor, and thank you. With the closure of this site, we will be working with our municipal partners to offer immunizations across each municipality over the next several months. For the first 2 weeks of April, appointment-based immunization clinics will take place in Leamington at the Nature Fresh Recreation Center. And following that, clinics will occur in Lakeshore and Atlas Tube Recreation Center. These clinics will be for our publicly funded, the immunizations we would normally deliver through the schools. Clinic locations, dates, and times will continue to be updated on the booking website at wechu.org/get-immunized. And additionally, eligible students looking to receive their vaccine can do so through their healthcare provider at no cost. Families and students are reminded that if they have received any immunizations under the Immunization for School Pupils Act, they need to submit the information to the health unit to ensure our records are up to date. This information can be updated online at immune.wechu.org or by calling our Healthy Schools team at 519-258-2146, extension 1222. Thanks to all our municipal partners who are supporting these clinics and allowing us to make this service more accessible to students and families as we continue on our vaccination journey. Thank you. I'll turn it over to Dr. Nasathuri.
So at the onset, thank you for allowing the Public Health Service to share its perspective today. I just want to emphasize it's really important to be up to date on all vaccinations. Vaccinations are one of the cornerstones of preventing illness in the community. And I'll comment on that in just a little bit more in a minute. Just briefly, we are in a period of increased disease activity with COVID-19, and my colleague Ramsey will share more granular data on that in a minute. With regards to being up to date on vaccine, it's important to be up to date on COVID-19 vaccinations. We know that the most severe outcomes from COVID are in people that are unvaccinated, and we would encourage people who are eligible for the booster injection to get the booster, those who have not started their primary series of vaccinations to get vaccinated. Perhaps there are, we estimate more than 50,000 adults in the Windsor-Essex Health District who are eligible for COVID vaccine have not received vaccine. Vaccines also play a big role in preventing other diseases than COVID. And I just want to share with you how important it is for young people to get vaccinated against the human papillomavirus. The HPV vaccine is effective at preventing a number of cancers. The best estimate we have is perhaps 1,300 cancers could be prevented if people were to get vaccinated, or 1,300 cancers are attributable to human papillomavirus infections. That includes cervical cancer, cancers of the external genitals of women, penile cancers, anal cancers, cancers of the throat and tonsils, or what we call oropharyngeal cancers. All of those are, a good number of those are preventable if we can get people vaccinated. And we would encourage people to get vaccinated, and young people to get vaccinated as they become eligible for it. It's sobering to think of that 200 women died of cervical cancer in Ontario last year, about 200, and about 400 died across the country. We think that with vaccination, that the vast majority of cervical cancer deaths can be prevented. So our core message today is to get vaccinated, and to get vaccinated when vaccines are available and you are eligible for them. They help people throughout the spectrum of their lifespan. If I could just pass it to my colleague Ramsey to maybe comment more on the epidemiology data.
Thank you, Doctor. Good morning, everyone. We'll just give ourselves a quick review of this week's epi summary. I'll just share my screen. 1 second. Okay, so let's begin with our case rates. For our most recent completed week, as we've seen in the past week, our case rates have been starting to increase. Once again, even though it's limited to our high-risk settings, we are seeing an increase in our case rates. It currently sits at 134 cases per 100,000 population. This is about a 10 to 13% increase from where we were last week. When we look at how our case rates compare to the rest of the province, we continue to be in the top 5 across all of the PHUs in Ontario. At the same time, though, we are seeing an increase in most health units in the province. When looking at our percent positivity, that same trend continues to what we've seen in the past few weeks. It has been increasing. We're currently sitting just over 16%, and it's been the trend for most of March. When we look at our hospitalizations, locally, this is the first time since about the beginning of March where we've seen a consistent increase in our hospitalizations in Windsor-Essex. At the same time, we are also seeing an increase in the province of Ontario. Keep in mind as well that these results are for the entirety of last week, and we've continued to see that increase going into this week as well. With regards to our wastewater surveillance, we have started to see an increase again towards the end of last week, and early signals from this week has shown increased viral intensity, indicating that we are seeing an increase in our wastewater surveillance data as it relates to COVID-19. With regards to our deaths have remained relatively unchanged from the past few weeks. We see about 3 to 5 deaths in any given week. In our most recent completed week, we've had 3 deaths compared to the 4 that we've observed in the week prior to the most completed reporting period. With regards to our outbreaks, we have continued to see an increase in our outbreaks as well. For our most completed week, we had 7 new outbreaks declared compared to the 5. Once again, with regards to the outbreaks that are being declared, it's primarily for high-risk settings, such as agricultural settings, long-term care retirement homes, and other congregate living settings. Moving on to our vaccine data remains relatively unchanged. We are seeing incremental increases in certain populations, particularly in the younger ones, specifically in our 0 to 5. But overall, the week-over-week change is minimal. With regards to our third dose coverage rates, it follows the same trend in terms of what we were seeing with our second doses, even first doses at times. It remains fairly unchanged. There is or has been great uptake with our older populations of those 60 plus, and those younger. There is definitely room for improvement in terms of receiving that third dose booster. And once again, with the distribution of the vaccine by geography, we continue to see the same trend where our hotspot coverages, for example, remain lower compared to the overall population. And just like in the previous slides, there is room for improvement, and they've remained relatively unchanged from where they were this time last week. And that's all for me. Thank you.
So Ramsey, if you could just share the data element. I think there were 50 people in this report who are currently hospitalized, and the more recent data, do we have the numbers from yesterday or the day before?
I'll have to look at that, but in terms of overall, we've seen about over 100 cases that were cases overall in terms of new cases for COVID-19. Additionally, at the same time, we have about 41 cases that are hospitalized. One thing that I did mention was we have newer ICU admissions, which we didn't have last week. Last week was the first time in a year, or not over a year, in close to a year since August of 2021, where we didn't see any new ICU admissions, but we did last week. So we are seeing increases in our hospital setting as well. But overall, that trend is increasing as from where we were last week.
Yeah, the point I think is worth emphasizing is that hospitalizations are up, and the number of people in the intensive care unit is up, and those are strong indicators that disease activity in the community is increasing. Is that a fair characterization, Ramsey?
That's true. Overall, for most of our indicators, like minus our deaths, we have seen an increase across all those indicators, signaling an increased burden in our community.
Thank you so much, Ramsey. We will now move into media questions, starting with the Windsor Star. Any questions from the Windsor Star? Okay, we'll start with CTV then.
Sure, good morning. At what point would you consider adding restrictions now that the high-risk cases and the hospitalizations are going up?
Well, every option that the Health Protection and Promotion Act gives to the health unit, we consider. I think at this juncture, I think we continue to monitor the burden of disease at the local health district level and at the provincial level. My preference would be that the province, if we are going to formulate additional policies or additional public health measures, that would happen at a provincial level or at a regional level. But as of today, we're not contemplating any specific directive. That being said, I think that my recommendation to the community is to continue with many of the public health measures, even though they may not be mandated. So I would still recommend that wear a mask indoors, wear a mask when you can't remain consistently 2 meters away from somebody else, to minimize the amount of social gatherings, stay home if you're sick, get vaccinated. Those are still our recommendations at the health district. I'm hopeful that we won't see even greater increased disease burden, but I think the facts are that we are seeing increased disease burden at this time, and hopefully it won't saturate or exhaust the resources we have within the community to manage COVID. I am also concerned about the burden of death. We had 3 deaths last week. I think we had 4 deaths the week before. I think we had 4 deaths the week before that. I think we had 5 deaths the week before that. That's definitely more than the number of deaths we'd anticipate for car crashes, many times more. So we remain concerned at the local health district level about the burden of disease in the community. And we're also particularly concerned because Windsor-Essex has suffered disproportionately from the burden of COVID-19. Sorry for that long-winded response, but thank you.
Thank you. So would you call this the 6th wave, or are you concerned with a 6th wave?
Yeah, I'm always reluctant to use summary metrics like wave. I think that's for our colleagues in the media and the general public perhaps to speak to that first. I am concerned about the increase in disease activity, though, and I am concerned about where this increase in disease activity might peak, and about how we can try to mitigate the effects of it. So, but we do remain concerned at the local health district level.
Do you think it would be really hard for people, and maybe hard for the health unit, to have people kind of go what they would see as going backwards, whether it's adding mandates or restrictions, when now they're starting to get used to trying to live life in their new normal?
Well, I think that every person's been affected by COVID, and every business and every enterprise and every organization. I do think that we all have COVID fatigue, if we could characterize it that way. And I think that all of us, would like to go back to some level of normalcy. I think going back to normalcy is not going back to the way things were before COVID. The pandemic is not over, and it doesn't mean it can't be managed, but it means that our decisions that we make as individuals and as community members and as organizations has to reflect the fact that we're going to have waxing and waning periods of disease activity. And we have to be vigilant to keep our vaccination rates up, because we know that unvaccinated people are the most likely to suffer the worst consequences, death and hospitalization from COVID. We also have this other challenge, which is that we have, and I can give you the exact numbers, but I think we have 150,000 people approximately who have 3 doses of the vaccine, and they're up to date. But the remainder of the population is either unvaccinated or is not up to date. And the people who had 2 doses of the vaccine, the second dose was in August, September, in that time frame, and there's waning immunity. So 4 and 5 and 6 months after their second dose, the level of protection decreases. And those are the people that add to the population of individuals who might be at risk for getting sick and being hospitalized from COVID. So I do think we're in a period of increased disease activity. We're in a period of increased risk to the community. I think that we have to take the measures collectively to decrease the risk and try to learn to live with COVID as best as we can moving forward.
Thank you.
Any questions from CTV? Or sorry, CBC?
Or a letter off there. Just wondering, Doctor, you mentioned the importance of the HPV vaccine for young people. I'm wondering about, there's a few generations that may not have been encouraged to get it when they were young, or it wasn't available. Is it still worthwhile for adults to be getting vaccinated against HPV?
Yeah, I think the current guidelines, and we can comment on that in writing because it's complicated, but I think that if you do not fit in the current availability, which I believe is, Nicole can correct me, is I think it's up to 26. I think so it's worthwhile for individuals to speak to their physicians, and then they can make a judgment together. Our emphasis at this point is to get young people in high school vaccinated. There's a substantive benefit in getting people vaccinated prior to becoming sexually active. And that is one of the reasons we are making an emphasis at the health district level and provincially, and as doctors overall throughout the country, to get young people vaccinated. There is benefit beyond to some people beyond getting it during this high school period, but I would ask those people to speak to their physicians and make an individual level judgment. Nicole, I don't know if you want to supplement that.
No, I mean, we can give you exact after, but I think you addressed it. Part of the push, obviously, right now is the no cost. So, the ideal period is, at the ages around the grade 7s, 8s that we're looking at, and it's publicly funded. So that's the real push to ensure that individuals in our community and children get the optimal protection, but also because it's research.
Thank you.
Any questions from AM 800?
Good morning, Doctor. Just in regards to the increase in high-risk cases, was that expected, or is it just catching, I guess, everyone off guard with how quickly it is happening, or was it kind of expected?
Well, I think that many public health officials recognize that as one reduces public health measures, as one reduces masking directives or mandates, reduces capacity limits, that there'll be likely some increased level of disease activity. So the fact that there is increased disease activity because of the relaxation of public health measures, as well as additional travel perhaps related to the March break, that was, I think, anticipated, was an anticipated phenomenon. I think the one thing we have to continue to monitor is what is the level or what is the magnitude of the increase in disease activity, and that's something we still got to continue to monitor.
Thank you, and I think this might be for Nicole. Nicole, just in regards to school-age children, I know obviously before with the outbreaks and the number of cases being reported at schools, things have changed there with how it's being reported. But can you share with us how area schools are doing? Are we seeing a lot of cases in Windsor-Essex elementary and secondary schools?
That might actually be a question best answered Ramsey, but so far we do still work with our school boards, and they do report absenteeism to us. We haven't, seen a wave of schools that have reached that threshold, which is 30%. But we are, starting to see, in some areas, a higher number, maybe not across the school, but certainly different classrooms, et cetera. So we'll continue to work with schools and monitor that with them and support schools as we've had in the past. Ramsey may have something to add, but at this point in time, we're not, nothing like fall, I would say, but also, as you noted, our practice and our approach changed.
Nothing more to add specifically. Just we do see some sporadic cases due to cases being household contacts of high-risk setting workers. But outside of that, we haven't seen a consistent in uptake of cases just based on availability of testing.
Yeah, if I could share, we're cautious about making inferences related to testing data because testing is curtailed, or testing at PCR level is curtailed. And without that, we don't have a fulsome estimate of the number of cases that are likely in the community. I would say that the number of cases in the community is the number of cases that the health unit is aware of is only a small or a proportion of the total number of cases that actually are existing in the community. And we are left, at least at the school level, to look at inferential data, including absenteeism rates, to help us make determinations of the burden of disease among the young people.
Thank you.
Okay, thank you so much. I think Nicole's going to jump off the call, but we'll do a second round of questions for Dr. Nasathari and Ramsey. Starting with the Windsor Star.
Hello, can you hear me?
Yep.
Hello? Hello, can you hear me?
Hello.
Yeah, we can hear you.
You can hear me. Okay, thank you. I was muted earlier before. So the province has promised increased accessibility to rapid antigen testing. What is the public health unit's recommendation for the public accessing and making use of these devices?
Well, I think anything that increases access to testing is an incremental improvement in the management of COVID-19. A couple of things to think of, though. The rapid antigen test, its level of accuracy is not as robust as a PCR test. So if you have symptoms, consistent with COVID, likely that you have COVID, even if the test is negative. The test is not entirely validated on the Omicron variant, so I think it's reasonable to use testing as one additional step, but to recognize that the testing has limitations as well. From a community medicine point of view, the most important thing is for people to get vaccinated. If we want to try to reduce the burden of disease in the community, it's continuing with the things that have been recommended in the past, which is to get vaccinated if you're eligible, to maintain physical distancing, to stay home if you're sick. Those are wear a mask indoors if you can, and wear a mask if you can't. Remain consistently 2 meters away from somebody else. I think those are the things that will help control COVID. I think rapid antigen testing is one additional item, and I am pleased that the additional tests will become available and continue to be available.
Where can people pick up the rapid antigen tests? I understand they'll be freely available at pharmacies and grocery stores and so forth.
To answer that question fulsomely, we should ask provincial officials, or if you could send us an email, we'll investigate that based on our best understanding and send you the information. But I do know that they have been available at grocery stores and pharmacies. But the full spectrum of distribution channels, if you send us an email, we'll comment on that.
Okay, thank you.
Final questions from CTV?
No, thank you.
Final questions from CBC?
No, thank you.
And final questions from AM 800?
No, thank you. Have a good day, everyone.
Perfect. Thank you so much, everybody. That concludes our media briefing for today. Our next media briefing will take place on Thursday, April the 7th. Hope you all have a wonderful Thursday.
All the best.
All the best. Thank you, everyone.
Thank you.
Bye-bye.